Firstly, I would like to apologize for the delay. This is the problem with, I think, with almost everyone in Malaysia. There's just so many meetings, and the meetings here take such a long time, man. Really don't understand. When you guys grow up, kan, bila besar nanti, when you guys hold positions, please lah reduce numbers of meeting. Not everything we need to discuss with so many people. And make sure lah you all nanti you all become leaders kan. Meeting tu you have to limit time meeting. Ini meeting long time doesn't make sense. Okay, all right. So we're going to discuss about communication in when I give me where's the slide, huh? Okay, can you guys see my slide? Nampak?
Yes, Doctor. Nampak.
Yeah. All right. So so basically, the topic we're going to discuss today is communication in pediatrics. So this is not this is a very new topic in our curriculum, because previously we don't discuss about communication skills and so on and so forth. I'm not sure about other departments, but even when I was a medical student, we were not taught about communication. The thing that we notice, communication breakdown, communication failure actually accounts for a lot of problem in medical care. Majority of the litigation, medical legal issues are actually stemmed from poor communication, from communication breakdown. We can prevent more than half medical legal cases if we improve our communication. So the main problem is communication. And you know, doctors, we from when we are in primary school, usually those who become doctors are the highest achiever, the nerds, those who are good in academics. But the problem being good in academics is majority of us are not that good in terms of social skills, in terms of communication skills, in terms of soft skills. Many doctors are not that good in terms of that. And that is the problem, because being a doctor, you are basically dealing with human. We should be the best in terms of communication, because we touch patients, we touch human when they are at their lowest, when people are crying for help, when they actually need the soft care from another human being, which is a doctor. And so having good and better communication skill is actually extremely important. If you remember lah, dulu-dulu kan, even you yourself kan, kadang-kadang bila tak sihat, we have fever and so on so forth. And then the moment kita jumpa doktor, suddenly tak ada, fever tak ada apa semua kan. Because sometimes we just need someone to actually hear us. We just want someone to actually hear our problems. So having good communication skill among doctors is essential. It's very, very important. So that's one thing. So again, the first thing is that communication breakdown accounts for the major among the most causes of medical legal worldwide. Number one. Number two is that when you go for specialty training, either you go for master's exam or you go for membership exam, MRCP, MRCPCH, MRCOG, MRCS, MRCGP, and so on and so forth. Whether you go for master's exam or you go for membership exams, they are communication stations. They are communication stations. And what we found out is that many medical students, especially those from Southeast Asia, don't perform really well in this kind of exam, where you are required to communicate with your patient and so on and so forth. So this is a challenge. And another issue why we propose this topic is that when so now the first, because you are now in the new curriculum, so the first batch that undergoes this new curriculum are now in 5th year. They just joined 5th year. What we notice is that in the new curriculum, you have the man or ski, and one of the station for the man or ski is actually communication station. The problem is that what we found out is students perform extremely poorly in those communication station. Students perform extremely poorly, very, very bad in the communication station. So that is why we think that it's a bit unfair for us to test you for communication when we don't actually teach you about communication skills. So hence this lecture was started, I think I reported for duty in January 2020. So, and then I proposed in the departments, and I think the first of this lecture, so I've been giving this topic since March 2020. The problem is, since March 2020, since I've been giving this lecture, it has not improved. So even in the last exam, there's no market improvement. And that is actually a bit depressing for me, because I've been giving this lecture. The purpose of this lecture is actually to improve communication skills in students so that you can perform better, at least in exam. But the outcome so far is that there's not much improvement. There are still students who fail communication station, which is a bit sad, which is a bit sad. So I'm not sure now whether is it the problem with. So before we have this lecture, we think the problem is the system, because we did not put it in curriculum. So we put it in curriculum, and then probably because it's new, so we think probably the student didn't get proper exposure. But now, even after 2 years of having this lecture, there's no market improvement. So I'm not sure. Probably the problem is with the communicator. We'll see. We'll see what happens with your group. So if you think about communication, there's always several elements of communication. There's the sender, whoever is giving the communication, the receiver, and there's the message. There's the sender, there's the receiver, and there's the message. The message, it must be encoded in the code may be linguistic code, English, Malay, Arabic, for whatever the code is. The code can be SMS, the code can be WhatsApp text, the code can be email, the code can be visual messages, and so on and so forth. So the message must be encoded and it must be decoded. And the process between encoding and decoding, there can be noises. Apa noises dia? Contohnya tak ada line, kan? You tengah telefon, phone line very poor. Suspect is notorious for not having phone lines, kan? So you didn't get proper information. Lecture. Now I'm the sender. The message is what? The message is the lecture. It must be encoded. How do I encode it? Several ways. The first one is the slides. The second one is by my lecture itself. So these are encoded. What are the noise? Poor internet connection, poor sound, my voice. If the voice is too much shrill, for example, kan, high pitch, kan, kejap dengar bunyi ting ting ting, message masuk. Those are all noises, and these noises can affect the decoding and interpretation of the message. Okay. So importance, as I mentioned before, in Harvard Medical School, they reported that communication failures are linked to more than 1,000 deaths in the past 5 years in 2015. So from 2009 to 2013, more than 1,700 deaths is actually linked to communication failure, and 40% are ambulatory setting, mana outpatient, 44 inpatient, and 8% are in emergency departments. So when they evaluate the malpractice issues, they notice that miscommunication of patient's condition accounts for 26%, inadequate consent, 13%, poor documentation, and so on and so forth. So what I'm trying to show you is that we have enough evidence showing us that a large number of death is results from communication breakdown. A large number, as I've informed you, a large number of medical legal cases actually stem from poor communication. When we don't communicate well, there's a lot of problem can happen. What are the challenges? So as doctors, sometimes we don't actually spend a lot of time with our patients. So patients usually spend more time with nurses. So this is a lecture that I also give to nurses, because caring for a patient, it is more important for nurses to actually have very good people skill. It's very important. But doctors, we spend time in clinics when we clerk patient and so on and so forth. And you need to remember, communication with patients, it does not necessarily mean when you want to counsel about diseases, when you want to counsel about results. It's not just about you counseling about how to manage the patient, how to treat the patient at home. It's not just about that. Communication also means when you clerk the patient, when you get history, when you do history taking, that accounts for communication as well. Even when you go for physical examination. So in physical examination, there is also communication. So communication is not only verbal. Communication is not only verbal. Physical and so on and so forth, those are among the methods of communicating. So every contact you have with another human being, every contact you have with your patient, that is part of the communication that we need to improve. And those are the things that we are trying to assess. Throughout the lecture, I'll discuss some of the rubrics that we assess in exams. And in communication, more than 80%, so verbal, even when giving lecture, only 20% is actually communicated by verbal. Whatever verbal that the sender is projecting, it only accounts to 20%. So 80% comes from other non-verbal types of communication, from the slides, from the facial expression, from the body language, and the tone, and so on and so forth. And when we communicate with in our clinical setting, we communicate with patient, and you remember patient as well. Our patient in pediatric department are children, and children, they are different. You cannot communicate with children as how you communicate with adults. And it's not enough for you to communicate with the patient alone. You need to communicate with the caretaker as well, with the father, with the mother, with the grandfather, grandmother, and so on and so forth, with the caretaker of the patient. And we also need to communicate with other staffs, because how we communicate with other staff will actually reflect on the quality of our care, and it will improve on the quality of our care if we don't communicate things well to other doctors. If the specialist, if me as a specialist, I didn't communicate well my instructions, the MOs will not understand. The MOs will not be able to perform the duties and the care of the patient as properly. If we do not communicate properly to the nurses will not know what do we actually want as part of the clinical care for the patient. So it is very important that we understand that the communication takes many levels: patient, caretaker, other staffs, admins, and so on and so forth. And we need to remember as well, different people have very different personality, and we cannot treat everyone the same. It's not possible. So certain people we need to treat differently, certain people we need to treat differently. We just have to acknowledge, because we cannot change others, but we can change how we communicate, because the objective, the goal is actually to improve communication. The objective is actually to improve communication so that it improves the quality of care. So that's the objective. So we cannot change others, we cannot change the personality of others, but we can change how we communicate, how we project ourselves. So we is among the areas within our control. Others are areas beyond our control. We cannot change others. So the first thing is, children are not small human. Children, they are not mere homunculus. Dia bukan just homunculus, dia bukan just a small human being. They are not miniature adults. Dia bukan macam mini-me ke apa. They are not miniature adults. Children, they have different cognitive development. At different age, they have different cognitive development. So how they understand things, how they see things, how they communicate, they have different motor and speech development. So how they communicate, how they understand your whatever we try to imply to them, they are different according to different ages. It never means that if we talk to babies, then we need to talk in baby language. No, it doesn't mean that. It's just that how we formulate our language, what is our expectation, and so on and so forth, it must differ according to children. And we should never neglect the children. Sometimes I've seen students masalah exam kan, kita suruh dia macam nak for history taking or for physical examination. Sometimes student apa dia buat? Dia sama ada dia only cakap dengan parents je. Dia bagi tahu parents, okay, kita nak buat macam ni. And then only communicate with the parent. Didn't even communicate with the child. Treat children tu macam apa? Macam specimen je. It's not right lah. Because that child is your patient. That child is a human. That child has his own dignity. That child has his own rights. So we need to acknowledge them. So communicate with them. And I've seen juga students, they only communicate with the children, with the child. Dia cakap dengan budak tu je, with the patient, and neglect totally the parents. That is not right as well. So we need to communicate with all. So different upbringing in children have different communication capabilities, different parental expectation as well. For example, Southeast Asian community, especially Malays, we are taught to benda macam you don't speak above adults. Kan, kalau kita cakap, kanak-kanak, orang tua tengah cakap, you keep quiet. So sometimes if they are taught like that, it's going to be difficult for us to get history from children because they are taught when there's adults, children must keep quiet. For example, but this is different if you go to Caucasian Western countries. They are taught even if you're children or whatever, you need to speak up. You need to speak up. That's why when I was in London, one thing I noticed, even my supervisor was the vice president of RCPCH. She's the most powerful neonatologist in Europe. She's superb. She's very major person. But even medical students can say even medical students can question her. Even nurses sometimes, if they don't agree with her, they just won't do because I don't agree with you. But this will never happen in Malaysia. In Malaysia, like our bringing up is you respect adults, you respect your boss. If boss say whatever the boss say, that's gospel. You just accept, which is not right. So this is the problem. So expectation, upbringing also will affect how we communicate. Next is newborns are still to be communicated with. Even if they are babies, if they are newborn babies, you still need to communicate with them. Kalau you dapat newborn baby, you tak boleh lah main ambil baby terus examine. No, you communicate with them. You show appropriate visual expression. You talk to them. You speak to them. Because even newborn babies, they can respond to social cues. One of the first sensory that they got as fetus is actually hearing. The first sensory that fetuses, babies get in utero is actually hearing. Allah mentioned inna sam'a wal basar. So you get hearing first, and then you get sight. So you get hearing first. So newborn babies, they are exposed to their parental voices, so they can actually respond to those kind of voices. So there's studies have shown as well, babies who are being read to, if you read to newborn babies, studies have shown that they have better literacy rate when they are bigger. So those babies who are being read to, they can read much faster than the other babies. So that's why one thing that we should do in NICU we have books so that parents can go and read the books to their babies. But this is very difficult for me to do in Malaysia. I don't understand why. We have books, but parents just don't know lah. Malaysia ni parents tak baca buku dekat children dia kan. So that's a problem. That's a problem. So we should read books even to newborn babies, because if we read books to them, they have better literacy rate, they have better linguistic skill later on. And studies have shown as well, newborn babies, even ventilated ones who are exposed to certain rhythmic sounds, they have better outcome. They were able to be extubated earlier. They respond better to treatment strategies. So rhythmic sounds ni macam apa? Macam classical music ya. So all the classical music, and also some studies have shown that certain Quranic recitation, for example, are very good in terms of improving outcome in newborn babies. So we need to make sure that they are exposed to this type of communication. Okay, next, when you communicate with patient, okay, so again, as I mentioned before, communication ni is not just you counseling about something. It's not just you counseling about result. It's not just you counseling about management strategy, treatment strategy. It's everything. As long as there is a hablum minan nas, communication, there's interaction between human beings, it is a communication. Hablum minan nas. When you communicate with God, that's hablum min Allah, kan? So wherever there's interaction between human beings, that is communication. So the idea is, the first thing is, when you communicate with someone, it should be a planned session. You need to plan the session. You tak boleh macam, there's no such thing as kebetulan je you communicate with that person. No, it shouldn't be. Kan? Even if you meet by chance, but you still need to plan whatever you want. So everything you must have, it must be planned. You must have clear objective. Innamal a'malu bin niyat wa innama likulli imri'in ma nawa. Faman kanat hijratuhu ila dunya yusibuha aw imra'atin yankihuha fa hijratuhu ila ma hajara ilaih. So whatever it is, you must have a clear objective. When you meet the patient, when you meet the parents, what are the objectives that you want to reach with that session? Is it you want to counsel something? Is it you want them to understand the management strategy, the treatment plan? You want them to understand the results, or you want them to agree to certain procedures? Sometimes you nak ambil consent, you nak buat lumbar puncture, you nak buat surgery, so you nak the parents to understand the procedure that we are planning to do, the complications, the possible complications, and for you to get consent. Or is it for you to get history taking? Or is it for you to do physical examination? Or is it for exam? So you must have a very clear objective. And that objective, you cannot just, you alone ada that objective. That objective must be shared among all the participants. So everyone in that session must have the same objective. Tak boleh lah you nak pergi sini, orang nak pergi sana, then nothing will be achieved. Kalau parents nak jumpa tu nak marah kat kita, tapi kita punya plan nak buat benda lain, so it doesn't make sense. So the objective must be a shared objective. Must be a shared objective. So sebab tu, that's why I always tell students, one good thing for you to do is, okay, when you go for communication, the first thing you need to do is actually introduce yourself. Then you must always introduce yourself. For among the rubric for assessment in exam is whether you introduce yourself tak. You tak boleh macam, okay, this is patient apa semua, you clerk history. You tak boleh terus sakit daripada bila. No, you must introduce yourself. Assalamualaikum, give give tahiyah kan. Idza huyitum bi tahiyatin fahayyu bi ahsani minha aw rudduha. So you give tahiyah, assalamualaikum kan, good morning kan, and then you introduce yourself, who you are. So saya siapa, doktor, medical student, apa semua ni, who you are and who are here with you as well. Ni siapa, everyone in the room, everyone that is in the session, you must introduce. And then you ask them, cik nama siapa, kan? You tak boleh just you kenalkan then you ignore them. No, you ask them, cik nama siapa, ni anak ni nama siapa, panggil apa dia. So you get to know each other, kan? And then you beritahu, okay, hari ni kita nak, then you make sure that the objective is being understood among all, and you get consent. For example, okay, kita hari ni kita nak jumpa untuk dah dapat result anak dan kita discuss pasal result anak ni. Okey ke? Setuju ke? Okey, kita discuss pasal ni boleh. Dan kalau ada benda tambah, kita tambah lepas tu. So you make sure that everyone understands the objective and consented for the objective to be discussed and obtained. You nak get history, okay, hari ni saya nak dapat ceritalah pasal penyakit anak. You make sure that you make sure the objective is clearly understood by everyone and they give consent. If you ask them to give consent for the objective to be achieved, then everyone will actually support and make sure that the objective is achieved, even subconsciously. Next is, you must include appropriate personnel. Who do you want to be with the session? Is it you alone is enough ke? Ataupun you need someone else? Do you need a chaperone to be with you? Do you need someone, one of the nurse to be with you? Do you need a translator? Do you need other department? Do you need dietitian? Do you need physiotherapist? Do you need surgeon? Do you need ENT surgeon? Do you need whoever? Do you need your senior? Certain things you need a more senior personnel to be together with you. Do you need legal advisors to come together with the setting? So you need to be very clear. The session must be planned and include appropriate personnel. Okay. Next is, it must be scheduled. So ideally it must be scheduled. You must, okay, kita nak jumpa pukul berapa. Or even if you don't have time, plan. Okay, it must be scheduled. It must be a planned time. And then you must have adequate preparation. You must prepare. You must have adequate information. Include important appropriate personnel. You ask the questions that you allow them to ask questions, and the questions that you want to answer, and what are the concerns that they have. Okay. Next, setting of the communication. So it must have adequate and appropriate privacy. So but if you want to communicate something, for example, you want to call a parent saying that the baby actually has HSV infection, or last time we have babies with syphilis, kan? You tak boleh tengah ramai-ramai ada banyak-banyak parents yang lain dia cakap, mak ni baby ni ada syphilis, kan? Mak-mak lain pun dengar. That's not appropriate, kan? You nak bagi tahu contohnya, you have a baby who is very ill, who is dying. So you want to counsel, kata baby ni is dying, then you are not sure whether you are able to save. You want to issue DIL, for example. You tak boleh tengah ramai-ramai, parents tengah berdiri, dan you kata, okay mak, anak ni mati ni tak lama. That's not right, kan? You must have privacy sebab parents nak menangis, kan? Dia nak share intimate punya session, so they need to be with their partner, for example. So it must have appropriate privacy. It must be comfortable, kan? Tak bolehlah tengah berdiri, kan? You cakap baby dia nak mati, for example. That's not right, kan? Kita tak nak, because I've seen people bila dia dapat bad news macam tu je, pengsan, for example, kan, dia fainted. So you need to make sure that it is comfortable, because the more comfortable it is, the more easier for them to actually accept the information, the message that you are trying to give. If they are uncomfortable, if they are not comfortable, then the first thing that will happen is they will reject. The first thing that will happen is they will reject subconsciously. The moment they reject subconsciously, you will not get their cooperation. Okay, so you must have appropriate personnel. Who do you want to be with you? I've seen people sebelum ni, kan, you nak counsel, kita panggil parents dia, anak dia was quite ill. Baby tu, I remember baby tu we have one baby with hyperinsulinism. So baby ni ada hyperinsulinism. So baby needs lots of testing, need lots of prolonged medication macam diazoxide. So we wanted to counsel the parents that the baby needs diazoxide for prolonged period of time. Macam mana cara nak makan diazoxide tu, and then what to monitor. Then we call the parents. The problem is we didn't notice that. So we know they are Rohingyan, but we don't know that they don't actually understand Malay. They don't understand English. So we call them and no one can speak to each other. They're trying to say something, we are trying to say something. Kan? Ada juga sometimes tu dia faham Malay sikit-sikit, kan? So if they faham Malay sikit-sikit, how can you counsel about major things? Kan? So who do you need with you? So that is why always assess who do you need with you. And this area must suit the purpose. Kan, kalau for example sometimes when I wanted to counsel about baby's current condition, so I prefer to do it by bedside sebab parents tu boleh tengok baby tu macam mana, then I can explain, so this is the ventilation strategy macam ni, these are the observation, I can show the BP chart and so on so forth. So appropriate. But sometimes kita ada juga contohnya mothers yang kita nak ajar how to do chest compression on babies, macam mana buat BLS, basic life support on babies kalau kat rumah. So and then we cannot do it by bedside, kita kena buat dalam a proper room kan, dengan ada mannequin dia, ada appropriate equipment dia kan. So the room must suit the purpose, it must be appropriate and appropriate equipment, and there shouldn't be no disturbance. Tak bolehlah kejap-kejap kita cakap sikit ada orang call, kejap cakap sikit ada orang call, baby collapse. So it shouldn't be a lot of disturbance. When there's a lot of disturbance, then the communication will not be efficient. Next, introduction. I've mentioned before, you must always introduce the attendees, who you are, who are present with you kan. Yeah, not just their name but also their role. Kenapa dia ada? Kenapa ada dalam meeting tu ada dietitian? Kenapa ada nurse? Kenapa ada lecturer in your exam kan? Kenapa ada? So who are the attendees and what is their role? And also get consent. Maknanya okay, even if you want to get history taking, get consent. Okay, hari ni kita nak ni saya siapa ni siapa puan siapa nama, anak ni nama siapa. Okay, kita hari ni kita nak dapat cerita pasal penyakit anak ni okay, boleh kita bincang pasal ni. So you get consent. So if at least when you get consent, they will subconsciously support and cooperate with you. Next is ascertain the objective. So all attendees must know the purpose of the session. So you need to reiterate again. So purpose dia apa? Purpose dia nak history taking, purpose dia nak physical examination, purpose dia nak counseling ni, blah blah blah. So everyone must know the purpose, the objective of the session. Next is know the background. So background maknanya apa? You tanyalah, puan ni, mother ni kerja apa, for example. Sebab apa? Kalau diorang contohnya, if they are orang asli, uneducated orang asli, then the level that you need to speak must differ. Khatibun nas ala qadri ukulihim. You speak to people based on the level of understanding, level of comprehension. So if they are doctors, for example, if you are patient, kan, you ada satu child masuk ward, the parents are doctors. You cannot speak to them like how you speak to layman, because that is insulting. That is insulting. If my son is admitted in the ward, and then the other people speak to me like I'm a layman, that is actually insulting. That is very irritating. So that's not right. So we speak to them to the level that they are. Kan? It's not that kita bias to other people. Is that this is how you show respect. If you speak to uneducated orang asli, for example, but you speak with how you speak to a doctor, then it's not, you are actually dehumanizing them. You are actually not respecting them. So we adjust how we speak to them is because we respect them. So the language that they know, the language that they speak. Can you understand English? Boleh faham bahasa Melayu ke? Which language do you prefer? Kan? If they can speak in English and in Malay, ask them. Which language do they prefer for you to discuss? Kalau they prefer in English, some people prefer to speak in English. Some people they think in English and then they kena translate baru dia cakap in Malay. Kan? So what language do they prefer to speak? Some people takalam Arabi, kan? So tulab min Jamiah Islamiyah Alamiyah Malaysia. So should be able to takalam Arabi. So if you want to speak in Arabic, for example, then which language do you want? Do they prefer to speak? Kan? Because if you are speaking in languages that you don't understand, you need to get someone else to come and interpret for you. Because to translate medical information, you cannot just pick who Dick and Harry mana-mana. No, it must be someone that has a basic level of understanding of the subject matter. So you need to understand them. The work, what is their, what do they work as? Housewife kan? Never underestimate housewife. I know so many housewives who are very well educated. lawyers, bankers, accountants, doctors who are dia punya job, dia punya work tu dia kata housewife, but they are actually well educated, kan? They are actually well educated. So never underestimate housewives. So and then not just about their background, but also what do they actually understand about the problem. For example, if you want to discuss that, if you want to discuss about a child with diabetes, for example, you should ask them, okay, I'm sure I'm not the first doctor to actually discuss with you about this matter. I think you've been admitted for 1 week. You've been speaking to many of the doctors as well. So what do you actually understand? What do you understand? Boleh tanya tak? So you ask them to actually explain what do they actually understand about the subject matter. Why this is important? Because when you ask them first, then they tell you what do they understand. Sometimes people dah Google lah sebelum dia jumpa, dia dah Google dulu, dah everything is at the tip of your fingers kan. Dia boleh Google dulu the problem with the disease. Belum jumpa doktor lagi, dia dah Google dah the symptoms and what are the disease. Kan? Could it be this, could it be this? So you ask them what do they understand first, and then you can, that's, so you, bila you counsel, you tak payah begin from the beginning. You can assess, you can continue from what they understand, you can enforce, you can improve what they are understanding, and you can correct any misunderstandings. You can correct any misunderstandings. So always ask, kan, before you start, tanya, okay, what do you understand about the issue? What do you understand about your child? What was informed? Kan, anak tu tengah tak okay, I always cakap, nak cakap anak dia tak okay kan, I always cakap, mak pun dah tengok keadaan anak ni kan, dan saya rasa mak pun dah cakap dengan other doctors, you dah cakap dengan nurses, apa mak faham macam sekarang ni. So you ask them, you assess their level of prior understanding, and then you ask them to what do they expect. So daripada session ni, apa yang mak rasa mungkin yang mak nak achieve. Ask them what do they achieve, what do they expect, yeah, from the session. Next is again assess the understanding, assess the level of prior comprehension, use language accordingly. Avoid jargons where appropriate. One of the rubric that we assess masa exam adalah usage of jargon. If you use too much jargon, macam mak jargon seorang tu, if you use too much jargon, then it will not reflect good, kan? So ideally, when you speak to layman, you should limit the amounts of jargon, but you should also use jargon when appropriate. For example, you want them to understand about G6PD, then you should tell this is G6PD. Kan, cuma kalau you nak bagi nama panjang ni, glucose 6-phosphate, so sometimes people may get confused. So you need to use jargon when appropriate, but ideally you should avoid using jargons most of the time. You need language line. So language line ni sometimes people yang tak boleh cakap certain language, dia ada phone number you boleh call, you can speak to the phone and then dia akan translate kan, and so on and so forth. Next is cover the concern. So ask them, apa concern dia, apa kerisauan dia, apa isu-isu yang dia nak bawa. You assess what are those issues, and then you make sure you cover all the issues. You make sure that you have discussed all the issues that they are concerned about. Next is always reassess understanding. So throughout your process of communication tu, every few minutes you tanya, okay, kita dah discuss, mak faham ke setakat ni? Apa yang mak faham? Kita dah cakap for 15 minutes. Kan? Apa yang mak faham setakat ni? So always reassess comprehension. You tak boleh cakap for 30 minutes but they don't understand anything. Faham tak? Like I've spoken for 39 minutes. I don't know whether you understand or not. Kan? So reassess comprehension. Reassess comprehension. And one good technique is that at the end of the session, kat hujung session tu, you formulate a conclusion. Okay, mak, kita dah discuss about anak ni ada diabetes. Kan, kita discuss for half an hour dah. Mak faham ke? Apa yang mak faham? Okay. So kita dah discuss pasal ni, penyakit dia mak dah faham. Mak dah faham juga pasal treatment dia. Kan? So treatment dia, kita setuju tak? Treatment dia, kita kena start insulin. Insulin ni kena ambil macam mana mak hari-hari kan? So we formulate the conclusion. Kita dah tahu apa conclusion, apa treatment strategi yang kita nak. Kita nak buat sama-sama dengan mak. Kita nak buat dia as parents, as caretaker, as the patient himself boleh faham the strategy, sama-sama buat conclusion. Okay, antibiotik nak kena habiskan for 5 days kat rumah. So caretaker setuju, patient pun setuju, antibiotik 5 days. makan oral. Kalau tak boleh makan antibiotik, datang hospital, kita pasang rice tube. So everyone understands the objective, everyone understands this one. So formulate a conclusion together, so everyone will agree to the treatment plan. Other important points. Okay, the first one is empathy. Empathy is super important. So empathy is not sympathy. Empathy is different. So can you be emotional with your patient? Boleh tak kita beremotional dengan pesakit kita? My answer is you can be emotional with your patient, but you should not be emotional towards your patient. You can be emotional with your patient, but you should not be emotional towards your patient. So that's different. With and towards, it's totally different. So it is okay. Kalau I've seen so many children dying in the hospital. It is okay. Parents will cry. Parents will cry bila anak dia meninggal. No one will just anak meninggal happy. No. People will be emotional. People will cry. Even our Prophet Muhammad SAW pun cried when his son died, kan? So people will cry. That's people will be emotional at times of death, at times of suffering. It is okay. We should actually. It shows our respect. It shows empathy when we are emotional together, in sync with them. They are sad. We show our sadness, that we share their sadness. That's what we should do. It must be appropriate emotion. Tak bolehlah dia sedih, and then kita sengih-sengih. Mak, itulah, minta maaf lah, anak dia dah meninggal dah. Tak boleh, no. That's actually evil. That's actually inappropriate. That is inhumane. And you must show appropriate emotion at the appropriate time. Sebab itu sometimes I've seen situation where tengah sedih, parents tengah sedih, anak meninggal, ada staff gelak-gelak kat belakang. So that's not right as well. Everyone in that area should show appropriate emotion. So that is empathy. We show the appropriate emotions. We show appropriate emotion. Bila dia tengah happy, completed chemotherapy, in remission, kita kena bagi tahu the emotion pun must be a happy punya emotion. Tak bolehlah pula anak dah in remission, tak ada ni, kita pula buat muka sedih. Oh, sedih lah sebab apa tak ada patient lah. No, that's not right. So you show appropriate emotion, and we show that we are trying to understand their feelings. I myself have cried so many times with the patient, because I think that's how we should do. We are human. We need to show them that we are human. Next is using open-ended questions. So you need to use open-ended and open-ended versus close-ended, or even open targeted questioning. So open-ended question ni contohnya macam you nak get history, kan? You kata, okay, apa cerita, apa masalah datang hospital ni? So you nak ask them to tell their side of the story, rather than ada demam, ada batuk, ada sesama. So because you tanya macam tu, the answer is just ada demam. Answer is yes or no. Ada batuk, yes or no. Kan? Sometimes you do need to ask. You suruh dia cerita, dia punya cerita tak ni, then you guide them, you target them back. Okay, tadi cerita tak sihat ni, ada demam ke? Kan? Dia answer yes or no. Then you guide them. Boleh cerita sikit pasal demam tu. Demam tu macam mana? Batuk tu macam mana? It's not just batuk tu ada macam anjing tak? Dah lah, tak menarik kan? Barking cough. Kan? Janganlah. Orang Melayu kan allergic dengan anjing kan? So, you give bunyi macam batuk tu macam kasar ke? Sometimes you do need to give example, but do not feed words into the mouth. Ada bunyi macam ni ke? So sometimes you give you option. You give you option. Sebab kau tahu, kalau you bagi satu option je, ada bunyi macam anjing tak? So sometimes you are feeding words into their mouth. So sometimes kalau dia dah penat, kan, dia just kata, yes, macam tu. Kan? But you give option. Ada bunyi macam ni tak? So you need to understand how to use open-ended and how to use close-ended or even close-targeted types of questioning. Okay. Next is always be a good listener. You must be an active listener. Why? Because only a good listener can be a good speaker. You will not be, it is never possible for you to convey the message appropriately if you are not a good receiver of the message. Faham? You can never be a good sender of a message if you are not a good receiver. So only a good listener may be a good speaker. And when you listen, you need to listen to understand, not to respond. Spin salah spelling. So listen to understand, not to respond. Bukan you dengar tu macam kat Facebook lah selalu kan, orang baca sebab nak reply. No, it is not for you to reply. It's not for you to respond. It is for you to understand. Listen to understand, not to respond. And always have good body language, good eye contact. Body language maknanya bila dia cerita, you angguk, you show that you are. Jangan pula dia cerita you buat muka macam menyampah, bila nak habis kan. No, you show that you are interested to whatever they are trying to tell you, that you understand kan. Body language, eye contact, and so on and so forth. That is non-verbal. So non-verbal things like intonation, important things you say with higher intonation, less important you show with lower intonation. More important, pacing must be slower. Less important, faster pace. Appropriate facial expression. Sedih, buat muka sedih. Happy, buat muka happy. Appropriate facial expression. Facial expression is very important. Facial expression will show your sincerity. Facial expression may reflect your sincerity. If you show appropriate facial expression, it hits into the subconscious mind. Kan baru message tu boleh dapat masuk dalam. If you do not show appropriate facial expression, the first thing is subconsciously dia akan kata you are not truthful, you are not honest, you are not sincere. So dia akan start dengan rejection. Because human being ni kita ada firewall. So this is protective for us. So kita kena show appropriate facial expression, appropriate body language. Macam mana kita positionkan badan kita, macam mana kita positionkan kita punya tangan, for example. Kalau kita belum apa-apa kita dah defensive. So this is defensive body language. Kan? So is it open body language or defensive or closed body language? So appropriate body language actually helps for you to actually convey the message better. Position. Sometimes kan, kalau dulu-dulu kan, if you look at dulu-dulu punya clinical setting kan, kita duduk, patient ada meja, kita meja, lepas tu patient, kita opposite. Satu adalah kita opposite with the patient. It conveys the message that we are opposite to them. Nombor satu, and there's a table which is a barrier. So there's a barrier between us and also the patient. So sometimes sekarang ni more people they tend to do side by side because we are together with them. So more pressing issues, more macam breaking bad news. So sometimes kita even suka letak kita duduk sebelah pada the receiver. Sebab bila sebelah, it conveys the message that we are together with them. So we are with them rather than we are opposite to them. So position is very important and it should depend differently according to the situation. Ambience of the room. Is it macam more sad, is it joyful, is it happy, and so on and so forth. So touching as well, sometimes kita touch, there the technique of the touching lah. I'm not gonna go there. Next is mirroring. So mirroring ni maknanya apa? Maknanya if they are standing, then you stand with them. If they are sitting, it's not okay for them to sit and you standing. Tak boleh. Dia kena mirror. Dia sitting, you sit. Dia standing, you standing. Kan? So bila dia mirror, it gets the message better across. So mirror. Dia sandar kat dinding. Then you sit also, you sandar dekat dinding. Because when you mirror, subconsciously it helps them to actually accept the message better. So this is another method. If you go to literatures, many literatures suggesting this spikes technique of communication. So what is spikes? Number one is setting up the interview. Mentally rehearse. So bila you nak meeting, you nak buat apa, you mentally rehearse, you plan, and you arrange privacy. You should sit down, use open body language. P is for perception. Elicit the patient's perspective. What do they understand? What are their beliefs? What do they feel about this issue? Assess vocabs and comprehension so that you can use the appropriate level of vocabulary and you can counter and you can improve the level of comprehension. I is for invitation, so you invite. So you invite them to share. You invite them to, you ask them what do they want to know. Because if you answer what they want to know rather than you enforcing what you want them to know, so it gets the message across much better. And obtain permission to share knowledge. So sebelum you kata okay, diabetes ni, then you can just say, okay tak kalau saya nak discuss pasal diabetes anak ni. So you invite, you get them to give consent for you to share the knowledge. Then subconsciously, the message will get to them much easier. K is for knowledge, provide information in small pieces and use simple language, avoid jargon. Again, avoid usage of jargon. It's among the rubric that we assess in the exam. E is for emotion. You need to explore, you need to explicitly recognize the emotions that they are showing, and you need to empathize with them. S is for strategize and to summarize. So you make the strategy together and you make the summary of the discussion together with the receiver. And then always arrange for follow-up, call for help. Maknanya when you discuss, oleh kata okay, we've discussed this. Do you want to meet with my senior? Do you want to meet with the specialist? Do you want us to arrange another session where I can call my senior, for example? Offer to refer. Do you want us to refer you to someone else? Do you want us to refer this? You want to refer this? Offer for refer and offer for follow up. Okay, we've talked about this for half an hour. And it seems that you have understand, but do you want to arrange another session where we can discuss again? So offer for follow-up. Offer for follow-up. This actually shows that you are safe. Because in medicine, there's no one that knows everything. Tak ada orang yang tahu semua. Kan? There's always something that someone else understands better than us. There's always something that someone else understands better than us. Kan? Whoever you are, you consultant ke, you apa ke, whatever level you are, there's always someone that understands something else better than us. So when you offer to refer, offer to discuss, offer to follow up, it shows that you are actually safe. This is the kind of doctor that we want. You know your limits. You know your limits. And other aids that you can use are basically all those visual aids. So sometimes recently we have a patient with complex congenital heart disease. So this type of patient, kita nak draw. So I draw heart. My drawing is bad, but then I show them. So this is the problem. So where is the lesion and so on and so forth. So charts, drawings, and so on and so forth. Okay. All right. That's it. 53 minutes. Any question? Clear? Boleh buat tak dalam exam ni? Sebabnya so far, as I told you, for the past 2 years, there's no improvement. So I'm so pissed off. I don't know. Is it my slide? Because your seniors, everyone got the slide. So you got the slide. Is it the slide is too boring? It's not interesting enough. You even have the lecture. So this, if you go to Paediatric Department IIUM punya YouTube channel, you'll see there's so many communication in pediatric lectures by me. But things are not improving. I have even told you what are the rubrics that we assess. What do we look? Whether you introduce yourself, whether you assess the understanding, usage of jargon, whether you're able to convey the message properly or not, whether you assess the understanding again, formulate conclusion. But no one does this in exam. No one does this in exam. Why? I don't understand. Fifth year now, the fifth year current batch now, exam in 2 weeks time, we'll see how they do, because they are the first batch who actually received this lecture 2 years ago. So they already received twice this lecture by me with just slight change. We'll see how they're going to do. So probably we need to change the lecturer that gives this lecture. Mungkin better sikit kot. I don't know lah kan. But we'll see. We'll see how it goes. So okay, any question? Faham? Clear? Tak ada? Okay, alright, fine. So again, I think this is just common knowledge. If any of you studied NLP, for example, you should have learned about this as well. Again, I can assure you this communication skills is actually very important when you all work as doctors. So I assume everyone here wants to become a doctor lah kan? Tak ada yang nak jual ayam ke, jual insurans ke, jual property ke, ambil study medik tapi nak jual insurans kan? Sebab jual insurans boleh untung lagi banyak daripada jadi specialist kan? Insurance agent usually they earn more than what a specialist in government sector earn. So so what is your goal? So I presume lah all my students wants to become doctors lah kan? So I can assure you when you understand and you practice proper communication skill, it will actually help you in the long run. Reduce it makes your patient understand and comprehend and comply to your treatment better, and it helps for you to actually give appropriate and better care for your patients. It reduces litigation and so on and so forth. Okay, all right. I think that's it. Okay, clear? Okay, let's end the session with tasbih kafarah and surah al-As. Assalamualaikum.